Well, good afternoon. Good afternoon to the panel. Good afternoon to all the participants. When I woke up this morning and saw the weather, I said, fantastic. People are not going to go for a walk. They're going to come to this session. So thank you very much. And I'd like to encourage particularly those people who might want to participate in the discussion and also put some questions to our speakers. There are wonderful seats here in the first row. You know, please come up, please see this as something we do together and not something where you're only listening. So I'll be looking to you to also see who wants to raise their hand. Whoever, I don't know if I should put pressure on you now, whoever raises their hand then has to sit in the front row. But still, you know, you're not only here to listen, you're here to ask as well. And it's such a fantastic panel. There are some people here that you might not have a chance to talk with. Otherwise, I'll introduce them in a minute. I have brought with me for protection my polio bear that I was just given at the other event. So I will put him here and let's recognize some people might also still be at the polio event. We thought it's worthwhile to look at the SDGs again. Sometimes one has the feeling, particularly because of all the crises, that they're sort of forgotten. There are parts in the SDGs that we might like to rejuvenate, and I think some of the panel will come back to that. But clearly, there's also things missing in the SDGs, things that have turned up since they were adopted or gotten stronger, like the digital transformation, for example. And these are the kind of things we want to look at. We're, of course, incredibly concerned about the rollback that has happened with the SDGs, particularly over the last years, the COVID years. But the thing we want to explore particularly is the new developments and the new forms of cooperation we've had around science, around technological innovations, around data systems. But, and I hope we'll also come to that, in some areas, perhaps not enough cooperation, and particularly cooperation between, let's just stick to those terms for now, the global north and the global south. I'm still waiting for a genius to come up with new classifications that we can use here, because low and middle income countries doesn't work either. So let's just say we're all a global community and we should be sharing knowledge. We should be cooperating on science. We need to try and move forward together. And the question is, now that we've sort of fallen behind on the SDGs, can these new forms of cooperation and partnership actually help us catch up? Do we have hope? Can we move forward? And I'll be asking my panel some questions, and then also, as I said, open it up for you to some questions. I'll just introduce some of the speakers. We'll try and manage this setup. Those of you that have been to the World Health Summit frequently will know we're in this hotel for the first time. We're learning to use it. We're getting used to the hotel. They're getting used to us. And so we'll see what works. I've been told from others that, you know, you try and turn and then suddenly your mic's in your face. So we'll do our best, bear with us. So first of all, I'd like to introduce Hema Budaraju to you. She is the Senior Director of Product, Health and Search Social Impact at Google. Is that correct?
Yes.
Yes.
Thank you, Professor.
Then we have Dr. John Amuazi with us. He's the research group leader, Kumasi Center for Collaborative Research in Tropical Medicine in Ghana. A big welcome. We have Cheryl Moore with us, who's the Director of Research Programs at the Wellcome Trust. Welcome. We have Rüdiger Krech with us from the WHO. He's the Director of Health Promotion in the Division of Universal Health Coverage and Note Healthier Populations at the WHO. And we have Dr. Martin Fichet with us, who's the Global Head of Global Public Health at Johnson & Johnson. So would you give them a clap, a very nice welcome? So Thank you very, very much. And I'll actually start with three sets of questions that we've sort of looked at a little bit before, but, you know, not formulated word by word so that everyone can come with a long written response that they'll read out. We're very keen, as I said, to look at cooperation in science, technological innovations and data systems, and with the perspective of equity. The SDGs are about leave no one behind. And maybe, John, if I start with you, how do you see the chances for new cooperation on science, on data and technology? There's been such bad experiences around COVID-19. Do you think there's any hope for a little bit of optimism that we'll be able to move forward? You've had positive experiences in Africa in cooperating in new ways. So can you share some of that with us, please?
No, thank you very much for that. I think it's a really important question to step back and try and answer. And indeed, in Africa, I think there's been a lot more cooperation, I should say, forced cooperation on account of COVID, because there was almost little else to do apart from really cooperating when it comes to data and really understanding what was going on. Because there was so little of it available, and there was a need really to gather whatever little could be found in order to inform some of the decisions that would be taken. If you take a look at the COVID dashboards from all over, you would realize that they hardly reflected the realities on the ground, simply because the capacity to collect information on the ground was limited. You look at countries that share borders and you see completely disparate pictures with regard to infection rates, mortality rates, and so on. What this meant is that there was a frantic effort to gather all those little pieces to try to make sense of what the bigger picture might be. Unfortunately, I feel that the bigger picture is still not fully understood. And one clear evidence of this is even our inability to measure excess mortality from COVID in Africa. Everyone is still struggling with this, which is a very clear evidence of the absence of this, fundamental data which would inform decision making. So some of the experiences that we had were in the area of clinical characterization of COVID, for example. There were a number of countries that came together, developed protocols to try and understand what the clinical presentation of the disease is and ultimately the outcomes. What we quickly realized is that in Africa, the outcome of interest was perhaps less death and maybe more length of stay and more actually health outcomes than clinical outcomes. And this is still being looked at very closely. There was a lot of collaboration on clinical trials for drugs and for vaccines. I was still involved in the Antikov clinical trial, which is by far the biggest drug clinical trial for COVID in Africa. And that was a huge effort and still is ongoing. Vaccine clinical trials also I'm involved in across Africa. So this new shall I say, adaptive platform trial cooperation is perhaps one of the shining stars of collaboration across Africa when it comes to COVID research. And it is very clear that the adaptive platform trial is the way to go moving forward to try and understand not only COVID, but several other existing diseases which have plagued the continent and really are challenging what our understanding has been over the years regarding these diseases.
So, John, if I can summarize, you are optimistic. You think a baseline has been set, a baseline for something that can be sustainable, that can be taken forward. How's the money side of it?
Good question. Well, The money side, well, let me start. I am optimistic because I think we are in the right direction. We're moving in the right direction. Of course, we, again, with the Africa CDC having been set up almost at the right time, just when this kind of cooperation was needed. So we are on the right track, but there are some bottlenecks. First of all, in just the systems and the structures that will allow the delivery of actual interventions and products. I know there's the African Medicines Regulatory Harmonization effort, which is coming up very strongly. The capacities for ethical review, capacities for regulation vary very widely across the continent, almost from near zero to really high levels across the continent. So this forces, again, the need to cooperate, because if one country in Africa can rely on the review of a strong regulator in a similar country, then they are more confident to move forward. And so this is almost something needed. On the money side, this is where the rubber hits the road, I guess, and definitely a lot of challenges. You'd realize that especially post-COVID, Africa has been hit hard economically. It's pretty bad right now, and most likely will get worse next year. What this means is that governments are committing much less to health and much less to health research. So the gap is there. I think it's almost like a sinkhole waiting to, cave in. And I'm afraid that if the effort is not put in quickly and that sinkhole caves in, the repercussions will be huge. So I think now more than ever is the time to really gauge what the potential size of that sinkhole would be, and to be able to cushion it with the money that is needed. Where that would come from is a different question altogether. But I guess there are a lot of innovative funding mechanisms that can be leveraged. Of course, there's the FIF now, which is a great one. I think that's one really innovative mechanism. Of course, more along pandemic preparedness. But I feel there's need for a lot more.
Yeah, but I think your message about the investment in research is an absolutely critical one, the investment in science and research. And we've seen in a whole number of countries as they struggle financially, and not only in Africa, look at the science budgets, perhaps in some of the, let me call them carefully, more developed countries, that they are also going down. And the fear that, science innovation, particularly from the public goods side of things, is losing out as we need to solve other pressing problems in terms of, social protection and other things, is an important thing. Now, we have some organizations that actually are quite rich. Let me look at Cheryl. And it's been interesting to see how the Wellcome Foundation has actually also over the years become more and more global, has become very present on the scene, has actually been criticized for being so present nearly everywhere. Some of you will have read that Politico article saying, there's 4 or 5 organizations that rule the world of global health, and one is yours. But if you hear what John has just said, what is the direction you want to go into? How is that linked to that public-private mix of research funding? And where do you think you can really make that difference?
Yeah, it's a great and a complex question, right?
Sure.
So we are quite interested in investing in areas that need further investment. So we talk about the data gap, right? Unrecorded deaths, unrecorded births makes it very hard to determine the impact of any pandemic or other health condition. One of the things that we've supported is the African Population Cohort Consortium, which is Africa-based. And aims to gather longitudinal population data over an extended period, grounded in Africa, because the data sets that we use to make decisions and to do research are so often high income only. They're typically data sets that have been around for a while, high income, mostly men, mostly white. So we're looking at a subset of the population, and that's not going to give us the results that we need in science. So we're facing fundamental questions that face humanity right now that have a grounding in science. And we need to go back to the premises that science is based upon. And some of that is making sure that we've got sufficient diversity in those data sets. So that's one way that we're working. The other way that we're working is really looking carefully at the way we fund. And looking at how we can move the center of gravity further south. The APCC that I mentioned is based in Nigeria with an office in Dakar. One of our recent climate and health calls has a component requiring a PI in the global south. It also has a component requiring that there be the possibility for the results of the science to be taken up into policy in that local country. So again, grounding it in local circumstances, which we think is going to help to start changing the conversation.
Thank you very much. And that answers, of course, to that call of, also decolonizing, as people say, research, who are first authors, who get access to publications. We know that some of the publications themselves are now much, much more aware of this, when they accept manuscripts, etc. So we are seeing some change here. And I understood you correctly, we're also seeing some investment streams changing.
Yes.
And I think, that's a really important message from the foundations. Because there might have been a tendency to say, well, this is a safe investment if an American university with a certain name is involved, rather than, in quotes, trusting the high expertise that actually already exists in countries that have not had that amount of visibility to put their names forward. So I think that's a very, very important message that we need to be taking forward in this discussion. Martin, if I can turn to you in terms of the innovation debate that has been highly controversial during COVID-19. Your industry has been heavily attacked, saying you made your profits on the vaccines when they should have been made available to poorer people. There's the constant argument between innovation and IP, obviously. And we at the World Health Summit are also criticized for opening up to a partnership with the private sector. So if we look at the SDGs, and it's very clear in SDG 17 that we from the World Health Summit have subscribed to, we need new partnerships. And so my question to you is not to defend yourself in any way, but to say, where do you see this new partnership? How do you scale up innovation? And do you see chances to share it? And what boundaries might you find that stop you from sharing?
If I could just go back very quickly to the last point,
sure.
Because you talked about COVID being a disaster for partnerships and innovation. I disagree. And I think maybe we need to reset the discussion around COVID about what worked and think about also building on and investing on what works. So firstly, the innovation worked. We had highly effective RNA and adeno-vector vaccines. That was a result probably of 10 to 20 years of investment in vaccine platforms prior to that. So we can park that issue. So innovation, we all agree, is critical. The actual trials worked. They delivered data quite quickly. And then probably most importantly to this discussion, we worked very closely with institutions in Africa, indeed supported the building of new regional institutions, which I think are incredible in terms of their effectiveness during COVID. And we need to think about building on those. You mentioned the African Medicines Agency, which was extremely supportive in terms of providing degrees of regulatory harmonization we haven't seen before, AVAT. So being able to negotiate on a multinational basis in terms of treatments or strategically aimed at a particular disease never happened before. I would argue Africa CDC was an even more respected and stronger institution coming out of COVID. And again, these regional institutions, I think, were success stories in an extraordinarily difficult time, but were created rapidly and operated nimbly. And we need to think about continuing to invest in those and build them. So I just felt it was important that it wasn't all bad news. A lot of bad news, of course, but not all bad news. One other thing which I think is important, I'm an R&D guy, mainly development-wise. I'm a physician, but mainly I spent my career in R&D. We also saw extraordinarily skill and delivery in terms of high quality data in Africa. I'll give you an example. We undertook the largest ever healthcare worker study and using real world data, the Sasonke study, 500,000 subjects vaccinated in 6 weeks. And it took 2 weeks working with the South African MRC and authorities to set it up. Extraordinary achievement, incredible high quality data, never been done before. We need to build on these successes in terms of Africa delivering high quality data sets in the future in a more efficient way, actually, and leapfrogging the way it's been traditionally done before. So I just wanted to make that point out. We should always also think about what worked well. Okay. So our organization, as we approach global health, and we have a global public health team, we have an end-to-end model. So we have an R&D unit, we have an Africa unit, we have a strategic unit in between, we call it Lab to Last Mile. And we deliberately innovate against high burden diseases in Africa. So TB, HIV, neglected tropical diseases, dengue fever, we have in development, leprosy, Ebola, COVID. We think very, very carefully about what we bring to the partnership, and we try not to do things which we don't do so well. So what do we do well as an innovation-based healthcare company? We invent drugs, I would argue, reasonably well, and also medical technologies. We then focus on that, and that would be the convener, and bedaquiline, I think, for TB is a good example, to really bring partnerships around the problem. But we try to go deep on what we know we can do and bring uniquely as a solution. And we rely very heavily on partnerships at scale from many groups and agencies in this room to actually ensure that solution reaches the last mile and the impact it needs to. And that's going to continue to be our model. We're always looking for partners at scale. We've got fantastic innovations in dengue, bedaquiline in leprosy. We have an Ebola vaccine. Again, we can invent the product, we can get it developed and approved, but we really do need the partnerships to help us ensure it's procured, used.
And which are those?
Which are what the partnerships. So I'll give you some examples. So bedaquiline, we launched it in 2012, and it really didn't take off, even though we had a donation model for 4 years, until we negotiated a procurement strategy with GDF and the government of South Africa with a sustainable partnership that allowed us to continue to manufacture and allowed access and equity to the drug at a very fair price. And that was actually quite innovative at the time for a product like that in terms of negotiating access. That was important because we didn't have access before, and not at the scale we wanted to. Another example is, for example, we have very deep insights into how consumers behave from our consumer business. Why do they choose our products? Or why do people seek treatment? We're able to apply that working with USAID and the Africa CDC in understanding vaccine hesitancy and determinants of vaccine behavior and seeking in COVID, and also in the MenStar Coalition with PEPFAR in South Africa. So again, understanding what we can bring to the table, but then having some degree of humility to understand all the other aspects of what other parties can bring to actually bring the impact and solution.
Thank you. I want to go to Hima, but I know Martin wanted to jump in. John wanted to jump in quickly. I apologize.
No, thanks for that opportunity. You raised something that I thought was an issue that really needed to be addressed. It still needs to be, which is the issue of real partnerships with so-called LMICs, particularly in sub-Saharan Africa. With the COVID, what I realized is that there were a lot of good partnerships. So the question is, were these partnerships equitable? Were they equitably spread? If you look at the spread of trials for COVID, drug trials and vaccine trials, you would realize that Africa was almost completely left out in the beginning, save South Africa and later Kenya. This was not due to a lack of capacity to conduct trials, but largely due to the fact that there was sufficient access to patients in the global north, that there was no motivation to come to the global south, where perhaps the challenge would be that if you conduct trials there, then you are mandated to ensure that there is access. So I have a funny feeling that to some degree, the private sector was not as motivated as they might have been to conduct trials equitably as well. Of course, this is not just a function of the private sector alone, but reflects a systemic issue, what I'll call research equity, in the sense that how well spread out are these trials? Are they truly representative of global health or global populations?
Short
It was much,
but to be fair, we studied 8,000 patients in phase 3 in South Africa. We got data on the new strains, emerging strains from the next strains out of Wuhan strain, which I think was extremely valuable. And we also did the largest study in real world data in healthcare workers with Sasonke. So I would argue that wasn't a universal approach by private industry. So to brand it totally as a private industry approach is perhaps a little misleading. But I accept also the fact that we could have done more and the industry could have done more. But I do believe there was a learning there because the data were extraordinarily high quality. We managed to incorporate multiple phase 3 sites in South Africa, no problems at all in terms of our global network. And I hope others will see that and learn from it and incorporate more of those kinds of strategies in the future.
Thank you for that. And I'm going to let people from the panel jump in and out because it's important to also have a bit of that debate. And of course, what is coming out also for science, innovation and data is, as in another panel, somebody said, COVID-19 was an enormous learning machine. Mm-hmm. And the key issue is actually to have this, to some extent, rather cool analyses, what did not work, particularly what did not work in terms of equity, and to say, now we need to build that up and take it forward, and what organizations or what kind of approaches do we need to strengthen and move forward. And that's where I'd like to come to Hema, because again, here something totally new in terms of partnership appeared of, the big tech giants, as we call them, working with the WHO. Can you share some of those things with us? What was new to you about these partnerships? How did they work? How do you see them in the future?
Indeed, Professor. Thank you for having us here, and thank you to all of you as well as those online. First of all, I'm an incurable optimist. Like, there is no cure for me. But you have to believe that for the longest time, when private and intergovernmental organizations try to work together, the term that I learned this morning was strategic patience. I'm like, what? Like, I would really like to get to strategic impatience and get to saying, where can we actually move as quickly as possible? It's an enormous privilege to work with multiple local, national, and government agencies and WHO. And Rudiger, I'm really looking forward to working with you closely soon. What did we do as Google? Our role when you think about hundreds and millions of people on a daily basis, looking for answers to questions like, what do I have? What should I do? How can I be safe? Where can I go to get tested? Is this safe for me? What are the side effects? There are like millions of these questions on a daily basis. Our best role in this case was to give reliable, credible, relevant information in a way that is understandable to everyone. We are a platform for communication, and WHO actually was a phenomenal partner to us to bring COVID information to more than 200 countries in dozens of languages. I say this to my team that out of 25 years of my working life, the last 2 years in working on COVID has been some of the best contribution that I think I could make to technology, because singularly, you have to use technology as a force for good. And this was one of the first breakthroughs. Now, for a moment, if I actually say, let's look beyond COVID, right? There are many, many health conditions. How do we give people information all the way from the common cold and stomach cramps to chronic conditions like hypertension, diabetes, and others? How do we help bring this idea of credible, reliable information in a timely manner for everyone. Most of the panel touched here on equity, and you two did, Professor, and we can talk a little bit more about that. But relatable information at scale. How should we actually think about bringing help for mental well-being for people? Where can we find ways to identify places where people going through vulnerable journeys? What kind of coping mechanisms can we provide through Google as a platform? Now, the reason I bring these up is there is no single one of these examples where Google can go alone or any tech company will go alone. We're looking for partnerships. The only way that we can actually move forward is find the right combination of research, policymakers, innovation, technology, medical experts. It's not just health. There are many, many, many global problems that we can actually get to.
Emma, can you just, sorry for butting in, but I'm trying to move away from everyone just saying partnerships and not saying who with. So if you could, again, just like Martin has done, give some very concrete examples. We know now new partnership with WHO, totally new stuff that one didn't do before.
Yeah.
What are other such partners?
So I touched upon mental health as one of the areas, right? I think WHO has shared that like there's a 25% increase in people with mental health issues just during the first year of pandemic. So we work, some of the examples of partnerships in here is we work with the national crisis response lines. Mm-hmm. So for example, in UK, that is the Samaritan helplines. In the US, it is the National Mental Alliance, or in India, it is iHelp. But this idea of like, hey, when you're thinking about self-harm, when you're thinking about anxiety, the text and the helpline that we put up there has to go to someone. And these would be the specific partners who would be staffing and helping people cope and get through. We certainly talk about WHO quite a bit and our partnership here, but there are many other areas that I can actually go into, but I'm going to cede the mic back to you.
Thank you very much. So, one of the things is to really name these new kinds of collaborations and partnerships. Some of them were nascent before, but then, sort of really moved forward. And Rüdiger, I'd like to turn to you now. A lot of people say WHO is too slow and not creative enough around such new partnerships. Maybe also partnership isn't the right word. Maybe we need to find something that expresses these various forms of cooperation better. But I guess you have some examples where you would say, well, if people only knew that WHO was doing this, they might change their mind a bit. So what's new, particularly in your area of work?
Yeah. First of all, of course, we can always do better. But some of the things that we are doing, let me give you just some examples. When we had a campaign last year to ask people to quit smoking, we actually reached 3.5 billion people. The biggest ever campaign that WHO was reaching, I believe, more than COVID. Then we said, well, but people don't have access to help, right, when they need it. So we actually established a partnership with social media companies, with IT companies like yourselves and Google, and pharmaceutical companies like J&J and others, those that are on the essential medicines list on nicotine replacement therapies. Because, first of all, people need to know that there is help for them. And on social media, we need communities that then, when I have this craving, when I want to stop, I need to have access to a community that has experienced or is experiencing the same sort of things. So the partnerships with Google, Precodes, we hope to have Meta on board as well, to then have digital spaces where we can actually share our concerns, our cravings, and what we need to do, and others who are experiencing the same things, then giving you their advice. And then we need to have access to the right information. And what you were saying here is at the moment, of course, it's important that we have the freedom of speech. But at the moment, when you do use the Dr. Google for symptoms, you have all sorts of very good information, but then also some, information that is more, an opinion, right? At the same level. And perhaps we need a new collaboration to have also to say, yes, of course, it's important to have the freedom of speech, but then perhaps have a tag on saying, here is a peer-reviewed evidence that we know works for many years. So there's a sort of effectiveness with this as well. And this is one of the corporations that we have started. Another one, when again taking the example of tobacco, if you're a partner to the Framework Convention of Tobacco Control, one of the things you need to have also in place is to support farmers to move out of tobacco and to move into other crops. And I thought, well, perhaps we need to look at the purchasing power of the United Nations system, first of all. And then we started collaboration with the FAO, but also with the World Food Programme, who purchases billions of dollars on food. And together with us then to see in a couple of countries, in Kenya, now in Zambia and others, to say, how can we use the purchasing power of the World Food Programme, the capacity development expertise in FAO, and the health expertise from WHO to actually then convince farmers to move out of tobacco growth and move into something else. The reason why farmers still stick with tobacco is that the tobacco industry buys the crops, the harvest before it was done, right? So there is a stable income for farmers. And farmers told us, well, if you could match that, then we would be on your side. So we started a sort of revolving fund, and we then had contracts with farmers to say, we're giving you this money. And so we're actually not only matching this, but actually we're better than what you had with the tobacco industry. And we were very positively surprised that there was a boost of farmers who wanted to get out. The tobacco industry then bought all the seeds that we reserved for the alternative, high iodine bean. So because they saw that this is a threat, and they threatened our people on the ground. Life-threatening. And so there's a criminal act by the tobacco industry, as always, and we know this. But this innovative partnership then with World Food Programme and FAO, together then, of course, with the Ministries of Agriculture and Health and Trade in those countries, that has helped to actually have the proof of concept. And we can do this in all other countries now. So that's just two, where you're asking me what if people knew, two innovative partnerships that I think we want to sell.
Thank you, Rudiger. And I think you've touched on something that indirectly was a little bit also in some of the things that John said, that our whole notion of support financing partnership needs to change. For many years now, we've worked with what you could call an ODA model. And of course, ODA is a drop on a hot stone, as we would say in German. And of course, we've used increasingly over the last 20 odd years in our discussions in health, this term of investment in health. Perhaps not professionally enough in terms of what investment really needs. And yesterday in a panel, the head of the WHO Foundation said, we're not really where the money is and where the real tough investments are being made. And, your investment example from the tobacco industry, we also spoke then about what's the investment and the equity business, where do pension funds invest and all of that, and what are guidelines for responsible partnerships then. So if I could ask you to some extent, what principles do you apply to partnerships? What do you expect from a partner? Can I start with you, Cheryl?
Yeah, I think when the questions we're talking about that affect humanity have solutions that are grounded in science. If they are grounded in science and we're going to take action based upon the science, we must fundamentally have trust in that science. Mm-hmm. So we have to start with that, understanding what our partners, in many cases, policymakers, need to know to trust the science that's coming out. So we have something that is called the Wellcome Global Monitor that surveys people globally. And in 2020, 43% of the population trusted science a lot. Those same people surveyed said that they thought only 25% of their governments trusted science or scientists. So if that's where we are, I think a fundamental requirement of a good partnership is one where we are providing from the scientific base the information that is trusted to be turned into policy and change. So one of the things that we're trying to do is to ask those questions up front as we're designing the work that we're doing, to say, is this information going to be valuable to you, particularly in climate change and health? So there's a lot of data out there about climate change. It's been out there for a very long time, and we don't have the political will to move forward. So what is it that we need to be persuasive and to be considered reliable so that we can move the conversation forward? And that's how we see ourselves trying to show up as the right kind of partner with our colleagues across the ecosystem.
Thank you, Hema. Of course, your industry has been heavily criticized that it's actually contributing to the problem that Cheryl has mentioned because of the way your algorithms work, or however one wants to think about it. So you've taken first steps, to address these kinds of issues. Where do you stand now? And how do you want to move that forward? Because if we've learned one thing from the COVID pandemic, is that trust is at the center of it. And that means, both organizations that come together to work with one another need to trust one another, but the general public needs to have built trust to be able to accept maybe policies, or to know on what basis to criticize policies. So Hema, do you have some thoughts about that you could share?
Yeah, clearly a topic that is top of mind to a lot of folks in this room. As I said, this is also not the first dialogue that we've had. The first thing I'll start with is information is also a determinant of health. And the more I've been in this sessions for the last 3 days, it's not just information that's also a determinant of health. It's information and trust that will eventually be a determinant of health. And can we really move the needle? If so, we clearly, as Google and as a representative part of the tech community, have a responsibility, have a fundamental duty to bring in the best and the highest quality information and to root out misinformation wherever possible. I'm going to focus on the places where we can actually do the job well, which is how can we bring the best information to people? And let's actually, I'm going to combine two things. You also asked for what principles would you use when you choose partners? So to me, if we had to bring the best information to bear for people in a relatable way, then the partners who come to the table have to be symbiotic. We may be strong at technology, at passion, at making things come alive, but we really need the expertise, the scientific evidence, and the research, and the human connection, and the last mile communication to the people. The second thing that I would actually ask for is scale. How do we find programs that really make a difference to every corner of the earth? Because it is not good enough if we just do it in one place or two places or leave it from pilot. So I'm going to bring this back to, so how can we get information at scale to every part of the world? So the way that I would think about it is the role that we play would be how can we bring the best information, be it information modules on health, to how can we bring access to care in every part of the world? Those would be the two areas that I would focus on and find partners who are symbiotic. And we have a deep commitment to really bring incredible quality information.
Thank you very much. I'd like to turn to you, John. I'm thinking of, the big African Union, European Union summit that took place earlier this year. And Macky Sall, who is one of the patrons here of the World Health Summit, was very clear in his statement saying, and I paraphrase it now, we don't trust you guys anymore. So where are we on that? What is this feeling, and I consciously also say feeling, in Africa of distrust of the global north? And can it be addressed? Should it be addressed? Can science help address it? What kind of partnerships must be crafted so that that trust can be reestablished?
No, I think that's a great, but of course, a tricky question, and I speak only for myself.
Absolutely.
No. Indeed. No, but yeah, there is certainly distrust, and I think it's not for bad reasons, given all that has happened over the past a couple of decades. There is distrust largely on account of economic factors and almost the duality that is seen, especially with big corporations, particularly the extractive industry, and the way they have operated and continue to operate in Africa, juxtaposing that against the rhetoric that we hear regarding climate change and equity and so on and so forth. So a lot more talk than walking the talk, and perhaps a bit of a turning of a blind eye to what the realities on the ground are. Perhaps I think the strongest evidence of this duality is with regard to the climate change crisis, and how clearly countries in Sub-Saharan Africa are perhaps among the least responsible for the current climate crisis which we face, and yet will and do continue to face the brunt of the impact of climate change globally. The move towards more sustainable energy sources and so on, and the obvious incapacity of LMICs to engage as they would love to, and yet the expectations not really matching what is clearly known to be the capacity, while at the same time industries in the north and the west, benefiting from the same harmful practices that impact negatively on the environment and on health. So this is what generates a sense of distrust, and also an element of, for lack of a better expression, helplessness, because there's a recognition that these are the same activities that bring income to the countries. And so doing away with them is not an option on the table. At the same time, it is being said that these are the things that we have to do away with. And there seem to be little presentation of alternatives to these harmful activities. Now, that being said, it's not all doom and gloom, obviously, because we have seen quite a significant forward movement in terms of cooperation between Africa and Europe. Yesterday, I was in a session, the One Europe for Global Health session, which is clearly a recognition of the role that Europe would have to play in global health, but also recognizing that it is really global, and for that reason needs all the players at the table. The cooperation that we're seeing with regard to funding of capacity building and research capacity. I mean, I can single out Wellcome, for example, for the very deliberate effort that is being made to make funds available in LMICs and make sure that it's being LMIC led. And it's a very deliberate, Wellcome strategy, and it seems to be working to me. So what I sense is there seems to be some kind of duality, and is this duality that sort of frustrates a lot of LMIC countries, particularly the influence of China, the influence of even Russia in these very difficult times is also a challenge. And it goes beyond health into all the other sectors, but then comes back to bite on health. Well, I could go on and on, but I think these are the issues. But if I could touch on just one thing, perhaps, yeah, and this is just the issue of the partnerships and what this really means in terms of equity. Public-private partnerships are great. I've always been a big fan. I've studied them extensively, but there's also the power component therein, which is what I often worry about when the power is not in the hands of the governments, but is in the hands of partners. And this can be a challenge sometimes.
Thank you. Can I just take that challenge directly to you, Rüdiger, because there is this constant discussion about changing the governance of WHO, of reforming WHO in so myriad of ways that I don't think we need to go into. But really this issue about, who decides what should be the decision streams, it's also related to trust in WHO. And I think you experience similar tensions in a way. Some problems can't be solved. We call them wicked problems, but they need to be dealt with.
Yeah.
So could you give us some insight? Because, you gave us these examples of partnerships. There are other partnerships that WHO takes up that are looked at critically, particularly through civil society. It's been interesting to see that the WHO Foundation has now, refused money from a major company. So it's a very hot tin roof. So can you share some thoughts?
Yes, it's very heated up because, there's an urgency, no? We cannot just continue as we did for the last 20 years. And that's sometimes when I follow, perhaps I'm too long around the block already, but when I listen to some of the discussions, it's same old. And that we can no longer do. If there's one lesson from the COVID crisis is that, you could see what happens if health is not in our policies, right? And therefore, to have these incremental steps doesn't help us. So therefore, we need other partners. And as Cheryl, you were talking about trust. Yes, of course, it's all about trust. And when we engage in WHO into partnerships, we want to see this trust and build it up. And trust is such a difficult thing, right? So it's really hard to build it up. It takes a long time. And then it's like a gas, it evaporates if something happens, right? So we need to look into new partnerships in mainstream. And one part of this, when we look into new partnerships, is, are we serious and are we true also to our vested interests? So when I see a lot of partnerships, it's corporate social responsibility. And that's icing on the cake. Come on, right? So it's the 1% or something that you give from J&J, and you give out 40,000 whatever doses of something. But that's not the partnerships we need to have if we really want to build up. And that's why I'm so happy, J&J and others, that you see this also now differently, right? And all the new partners, I can only say, let's be mainstream. Let's look at what our real vested interests are. If they are coming together, we need to understand those. And also from our side, we also have vested interests at WHO, of course, obviously. And also be open about this in order to really move the needle forward, right? So we need to take risks in WHO much more than we did before. Tedros, very fortunately, is a person who understands this very well. We need to be very clear and take good care of our reputation, because that's so easily destroyed as well. But again, I think we're in a very, very difficult game now in the world, that without taking risks, being clear about them, being also clear about what then we can and cannot do, and under what sort of circumstances we can engage in new partnerships to not ruin our reputation in global health, not only as WHO, but as the global health community. That's a very different ballgame we're in, I think, and we will be in the next coming years.
Thank you, Rudiger. And that, of course, links to the context in which we are now, which is multiple crises, cascading crises, polycrises, permacrises. All these words are now out there, but it does reflect something that we are dealing with more at the same time than we did earlier. And that probably, also brings not only a push for partnerships, but also partnerships that lead to better integration of issues. You mentioned the climate issues, you mentioned the food issues, and I think a lot of more interdisciplinary research, for example. And so that we do need to redefine much of what we do. And I see, a fair bit of nodding here at the panel that we're really searching for how to do this. And I think in the terms of wicked problems, that the times when we thought we had the ultimate solution are over, that we also have to think in new ways of first do no harm, and in a new way about risk-taking. And I want to come back to Martin on that, because John mentioned geopolitics. And we're starting to see that innovation, science, data are actually becoming part of geopolitics. And that must have a consequence for your industry. Do you know what's being researched in China? What's the competition when data spaces are closed up? How does that help or hinder global health if we can't even share data? If WHO is not able to go into a country? So there are many of those kind of things. But I'd like to hear it from your perspective, Martin. How has that geopolitical context changed for your industry?
We didn't really think about it until COVID, and then I think many things went very well. But I think we also saw some geopolitical frictions coming in, particularly around free transport of goods worldwide. I think as countries became very concerned about their own populations, governments did what I think they're asked to do. They look after their own populations first. And we saw a lot of those behaviors happen around the world in many different countries. For us, that was a problem because we had a global supply chain. So we had vaccine substance going to production facilities, one in Africa, by the way, all around the world to be shipped. And those situations were not as frequent as people thought they were. But that's the first time I kind of really saw it happen. But then again, that was in the context of a pandemic emergency. So we also have to have some understanding of that. Look, I think we would all give the same answer on this panel, wouldn't we? It's never a good thing to have closed data. It's never a good thing to have geopolitics closed data sets or shut down access to information. Never. And again, one of the good news stories about COVID was the speed in which the genomic sequence came from Chinese scientists, and I think in January of 2020, but allowed all of us to immediately begin, I think in the second week in January, beginning to produce our vaccines. That's how quickly we started on our platforms. And that gave the world a significant head start. And I think that's just a perfect example of probably 20, 30,000 lives saved like that because of the time saved by open sharing of information. I don't think anybody is going to argue against the fact that open sharing of data and information is a very good thing, particularly when we're talking about genomic data, particularly when we're talking about surveillance data. And I think this also comes into the big question around PPR in the future. And I think the backbone of PPR has to be a global pathogen surveillance system that is open and comprehensive, but allows all access to all and depositing of information by all to a similar standard, And so everybody has the opportunity to interpret those data and to monitor impending threats.
Yeah.
And I think there's some very good proposals coming from the Africa CDC around this as well, which could actually potentially leapfrog ideas from many other parts of the world. So I think we should watch that space.
If I may,
Please.
Martin, I would absolutely agree with you. But then would this also not have an impact on IP, on intellectual property? Because if I take the example of the vaccine production of the COVID vaccines, there were hundreds of researchers sharing information which was not yet published in order to accelerate so that the companies would be able to use that information to the development of the vaccines. In the end, the IPs are held by very few companies. And I really think that, it needs to be seen if we have the next pandemic, and we will have it as we are seemingly not addressing the things at the root cause, then we will see that people will be less inclined to share this data if the IP issues are not different.
So that allow me to maybe predictably, you might think, but give a different perspective. So actually, transparency and sharing of information and IP as intellectual property as a way to incentivize R&D are two different things. They're not the same thing, right? So if you think about it, firstly, when we think about the, you talk about it being a disincentive, looking back on the model. Mm-hmm. But then if you think about the way in which the RNAs and the adenovector platforms were able to operate so fast, so quickly, is because hundreds of millions of dollars have been invested on those platforms, researching them 10 to 15 years before that day in February when we knew we had a pandemic on our hands. And so those platforms are ready to go. One could argue without an IP-based model, that investment would never have been made. So we've got to look at both sides of the story. There has to be some incentive for innovators all over the world, not just large pharma. BioNTech was not a large pharma. To actually innovate and invest in novel and diverse platforms. And by the way, we need to think about that now for the next pandemic, because an RNA might not work for the next bug. We've got to think about new platforms. And I don't believe you necessarily will get the investment across the whole biotech world, small, medium, large tech, unless there is some form of IP in place to incentivize that. I honestly don't. I don't believe anybody would think they'll work with her.
John, Cheryl?
Yeah, no, I just didn't, not on the IP issue, but more on the data access issues. Of course, data on mRNA and the basic science was shared openly by researchers in China and all over the world. But I'm more concerned about, access to and sharing of data on populations and on behaviors. And I guess this is where perhaps Google comes in a bit strongly, given all the access to data that you have. The mobile phone penetration in many African countries is more than 100%. So there is really the unique opportunity to understand populations at a level which even governments might not be able to. Now, how openly is that shared? What does it mean for data security issues and privacy issues? On the data sharing side, I think that's where we're lacking a bit. The basic science data sharing, I think we've crossed that. I mean, people are sharing stuff, but there's a deeper data sharing issue.
Fair point.
Cheryl, can I just go start with data and then to you?
Sure.
Is that possible?
Of course.
Yeah. Please.
Thanks, John. I'm happy to have a deeper conversation with you. There are three examples I would give, as Professor K would say, hey, can you be specific? I'm like, yes, here we go. One is COVID mobility reports. Like the community mobility reports are actually in hundreds of countries. These are insights that were presented primarily for the policymakers to understand whether the COVID precautions are working or not, or whether they need to be changed. And I'm truly happy to sit down with you and talk you through the community mobility reports, because this is like one of these, it was early in the days, but we had to look at our people's mobility in parks, restaurants, transit stations. Is this the same as before or not? Are people actually taking the precaution, like putting on a mask, staying at home, etc.? So this is an area that we're pretty proud of. The second one is search trends and insights. These are things that are actually tools that you can use today to look at what might be the movement or what might be the change, what might be the trend in certain types of either symptoms, behaviors, actions that people are doing. And these are free tools. Here's an example: extreme weather and extreme heat is another area, as we are talking about cross-sectoral ideas and weather. We are putting out insights that help policymakers, local and governments, take action and preparedness, because an extreme weather event 6 months down cannot be treated like a day before. We have to plan. But I'd love to talk to you a little bit more.
Thank you, Chair.
Yeah, just a few thoughts on this wide-ranging discussion. I think data sharing is absolutely critical. Open data, it's not going to surprise you that I'm going to say that. But one of the things that really concerned us were the penalties that were applied for open data sharing in relation to travel, right? And the damage that did disproportionately. So I think we need to keep our eye on that and speak out for that. We have seen, as a result of COVID, a significant increase in sharing. So sharing of genomic sequences is up 57% among UN member states. That's a great trend, and we want to keep that going, right? So we have learned some good things that will help us. I think last night I was at a dinner with some really interesting entrepreneurs who are rolling out companies, digital health companies in Africa. And they're going out and providing healthcare where it doesn't exist, and enabling those local healthcare providers to really upskill and digitize their practices. One of the things that I was thinking about from a more global perspective is what then happens when we have that siloed information, and how are we going to protect that patient information over the longer term? So while we're advancing with the digitization, we're also creating other issues. And so we'll continue to have to keep our eyes open for those things that are right around the corner.
Thank you. And that's, again, a definition of a wicked problem. I wanted to ask you one more question, and then I'll open up for questions or comments from the floor. And that is in relation to research cooperation. We've heard on the one hand, that really fantastic new things were possible. New money was there for research, for all kinds of things. At the same time, and I apologize to some of our international guests, but we are facing an issue here in Europe. One of the largest European financing of health, the Horizon program, has, two countries I know well, no longer part of it: the United Kingdom, that left the European Union, and Switzerland, that doesn't seem to manage to get a new kind of agreement with the European Union. And if we think of the excellence of research institutions in the UK and in Switzerland, and the loss for the whole world, because this part of the world does not work together as well as it did in research. You actually came to Berlin with an office partly for that reason. Can you comment on what can be the consequence of this?
Yeah, it's really beyond disappointing that we haven't been able to find a way to continue participation in Horizon. We need to make progress globally. If there's anything that recent years have taught us, it's that we need to all come together globally. And drawing up barriers is increasingly happening in many countries, and it's not going to help us advance. So the UK government is attempting to ameliorate the issue, but we do have to be concerned when flow of information and research projects are not truly global, because that's how we're going to make progress, and that's how we're going to get different perspectives by bringing people who aren't breathing the same air every day together. So it is a real concern.
So over to you, please. Yeah, start off. Yeah, please go ahead. Please don't bring long commentaries, but
I will try my best.
Yeah.
Thank you very much. I'm coming from Kurdistan, Iraqi Kurdistan region of. So I think I focus on health awareness because I have a health TV show, Health Awareness and Promotion, and I'm the president of Kurdistan Health Summit, which we focus on Iraq, Iran, Turkey, and Syria, and sometimes Jordan. I think because we are in World Health Summit and we are talking about the globe, but it's almost the last session and I haven't seen seriously discussions about this part of the world. I think it's forgotten. It's the population of 250 million people in 4 countries, human beings, and the area is full of conflicts, full of oil as well, and the conflicts are due to having oil there and no clean water, for example. So I have a question to Ms. Cheryl. As Kurdistan Health Summit, how we can communicate, and where's Iraq, Iran, Turkey, and Syria are located in your career, in your business? Martin, Johnson and Johnson.
Please, one question per person. No, I'm sorry,
okay.
I have so many hands here.
Okay, the question will be for all of them. Where our region is located in your plans. Thank you.
Thank you. That's a very good question. I am looking for a female hand, please. I'm not having all these men start talking. There's a female hand back there, I think. Please, can you stand that we can sort of see you, even with a mask?
Hello, nice afternoon. Thank you very much for being here. I have a question for you, Ms. Bularaye. You talked about that it's very important to give easy access to data, and I would totally agree, but I wondered if you are aware that often it's not easy, even if you want to, as a scientist. I'm a medical student myself, to share the data with the world or share your results or what you're working on, because for many platforms, you have to pay when you want to share your results. And it's not like a bit like you have to pay up to 1,000 euros or dollars if you want to give it like open access. So I wondered what your approach to that issue might be for the future. And I'm sorry, I didn't introduce myself. I'm Marlene. I'm a medical student and I'm representing the Medical Students Association Germany.
Thank you very much. Gentleman here.
Hello, Anthony Renshaw from International SOS. Now, in the 90-odd countries we deliver health services.
Could you stand up? I think it's so much nicer if people see you talking. Thank you.
So in the various countries we supply health services, the most trusted group in some of those countries is actually the employer. However, apart from health-related private sector organisations, there isn't much of a representation of that group. You know, your average employer. Now, some of the most impactful community health programs over the last few years, such as the Yours Eradication program that came out of an employer-funded community hospital in Papua New Guinea, have had tremendous impact. When are we going to have representation of the wider employer community on panels like this?
Thank you for that. Is that a female hand back there? Okay, then we come here.
Hi, thank you. I'm here representing AVPN. We're a social investor network. And my question is, well, a report or a trend we see across the 600 members or so we have, from foundations to corporates, is that more and more are looking to give to healthcare causes in result of some of the crises that were mentioned here, and then of course COVID-19. So my question is, how do you engage non-health expert funders and investors, and are those partnerships you're looking for? Thank you.
Thank you. Over here, gentlemen.
Yeah, thank you. I'm Andreas Wolf, Medico International and the German Platform for Global Health. I want to come back to the issue of mistrust, or the problem that we have seen. And I remember yesterday evening hearing Agnes Soukat from the French Development Agency speaking very clearly about our failure to really transform the traditional models we have on supplying global essential goods into this situation where we have a scarcity of the vaccines over the last 2 years, and I think this is, for me, was one of the central calls to say, okay, there must be a new thinking of solidarity sharing rather than continuing talking about partnerships when it's basically meaning to throw some money into a pot and then to see what comes out of it. And I think this is what I would like to, you might want to reflect on. Thank you.
Thank you. I don't actually think we talk too much about throwing money into a pot, but I think it's part of the problem, absolutely. So we've had a lot of commentaries. I have one commentary here, which is about solidarity. It's also addressed at the J&J Janssen vaccine. It says, coming from Namibia, I can confirm that the rollout was viewed in a rather high-tech lens from across the Orange River by Namibians. How can we dampen perceptions of exclusivism and help stop inequity through corporate partnering with governmental authorities in such a manner, meaning probably, to govern with one government rather than the other? So I wanted to give visibility to this as well. And it says, shall the implementation research be rolled out across the board once trials such as the Siskonka trial are completed? So would you start with that, and then we'll go around?
Yep, the answer is yes. I think, look, we learned a lot. We all learned a lot, but all sides and all parties learned a lot during the COVID lockdown and crisis and pandemic. And I think we need to all reflect on those, all parties, about what could have been done better. And there were things that could have been done better. However, we had some, I believe, some things which were actually worth celebrating. And I think when you do talk about the sharing around the implementation success of Sisonke, I think the challenge we had with Sisonke is we wanted to get a large amount of vaccine as quickly as possible to help South African frontline workers. And the best way to do it was to do a clinical trial. We had 500,000 doses of clinical supply. So we set that up very, very quickly. And the reason it works so well in terms of the implementation methodology is because the MRC, firstly, is an extraordinarily talented and expert group in South Africa. And the healthcare workers were linked by quite high quality, reliable electronic health records. So we were able to get very pragmatic, high quality data very quickly, almost instantaneously. And I believe to your question of the methodology and the implementation methodology around that has been published. And that questioner can always contact me, and I can put them in touch with Glenda Gray and the team at MRC if they want to share that.
Yeah, so they're online from Namibia, so I hope they will take up. And isn't it wonderful that people can be part of this in this way? Hema, there were some questions to you.
Yes, let me actually take your question first, because I know that we had a conversation this morning too. Rudiger, to your point, health at Google is not a corporate social thing. Like, this is not a checkbox for us that we did this and we are done. It's in our mission statement that we will organize the world's information and make it universally accessible and useful for everyone. I'd like to underscore everyone. Now, how do we do it in health? We'll have to find the right content partners, because we have to find the right experts to help put on the platform. We are in multiple conversations with WHO this week and many organizations. So let's stay tuned. And if you have suggestions and ideas, please reach out to us, because a large part of the role that we play is being conduits, but we need to find the right information. But it's our commitment, because equity is global, right? This is not a checkbox. There was a second question for me from the audience in terms of sharing. So I have to point out that maybe I did not understand the question. Any of the tools that I talked about in this session, in terms of the mobility reports, the insights, these are all free. But clearly, the asker of the question had something specific in mind. If it is okay, let's take it after this forum, and we will try and find a better answer for you. Yeah,
Rudiger.
Yeah. I want to take up the question from Andreas on do we not need to see things differently? There's, one thing, essential medicines are not a smartphone. Essential medicines are a global public health good belonging to the critical infrastructure to keep this world alive. So when we have the essential medicines list, and you have medicines on the essential medicines list from J&J, we need to treat this differently from a smartphone, where you actually set a price on the willingness to pay. Right? So we need to be clear, and therefore I totally agree with my friend Agnes Sukat. We need to think differently about what belongs to these critical public health goods, which are global, that needs to be accessible for everyone on an affordable price, and that is therefore keeping our world safe.
And you don't think a smartphone could be that?
Now, let's think of information. That is different, because there is some key information as well. This smartphone will be obsolete in a couple of years. We will see different things, how we're working in digital spaces in a couple of years. So let's be clear about what is critical for our survival in the world.
Yeah, and I think, though, this point is absolutely important. That's why I butted in.
Yes.
That, classically in health, we've said it's the medicines that are essential. And we're starting to see with the digital transformation that other things are essential, the access to information. And in order to have access to information, you need electricity, and you don't have it. And in order to have access to information, you need the instrument. Now it's a phone, it might be something else in the future. And that, our notion, what are essentials in terms of health and global health, what are the public goods, is something that in terms of partnerships and understanding, we also need to take forward. I mean, in our project, it was a tragedy for me. We interviewed young people from all around the world. And a young man said to us, in the morning, I decide whether I eat or I access.
Yeah.
And, these are not decisions one wants people to take. And even if he plays a game now and then, he should have the access to do that. But at the same time, he would have access to information about, what could my cough mean, and about my mental health, as you indicated. So I think as we talk public goods and global public goods and partnerships to establish them, we will need to go far beyond medicines, as important as they are. Cheryl.
Yeah. So a few things. First, where do we fund? We fund globally in our 3 health challenge areas, which are infectious disease, mental health, and climate impacts on health. We fund in the UK and lower middle income countries for our discovery portfolio. We fund everywhere we can by law. So employer funded impact, great comment, great question. I think as we look to solve these complex issues, we need to make sure that we're thinking broadly enough about who partners are, who really have a lever that we need to engage early on in the thinking. So I would say thank you for that comment. Donors who are not expert in healthcare, who are interested in contributing. This is a challenge. We get this question a lot. We're working with the Climate Leadership Initiative to identify specific gaps on climate impacts on health, where donors can come forward with an interest to solve a particular thing. So to sort of provide a menu of areas for people who want to engage, how they can engage. So watch the space for that. It's underway. And then I would just say, as it relates to solidarity and sharing of vaccines, I do think that this is something that the FIF is attempting to address by looking at the shared governance model that has donor countries and implementing countries equally represented. So I think we are, as a community, trying to learn from where we've been.
Thank you. I'll turn to John, and there might be 1 or 2 things you want to comment on the questions here, but I'd like you to reflect on our panel.
No, thanks for that. I think one thing that I see coming out of this is, as you rightly mentioned, a lot of things have happened which are very good, but they have invariably also exposed the gaps that clearly exist not only the gaps, but also the inequities that have been exposed as a result of this. And I think really focusing on how some of these inequities can be bridged in a very deliberate way should really have at the heart of it allowing countries, LMICs, and let me add also in the Middle East, as the colleague who asked the question, providing them the capacity to address their issues the way they would like them to be. The partnerships that are emerging are great, but I also would like to reemphasize again what that means for where the axis of power really would lie. Because ultimately, if the power is in the hands of the partners as opposed to in the hands of the governments who are responsible for the people, then it could pose a challenge. And I think this is one thing that we would need to pay special attention to. And finally, the issue of data and access to data and information in general. And I did emphasize that, and you put that really starkly, where one has to decide between having a meal or having access. And these are things that we see every day. The cost of data in many parts of the world makes it basically almost inaccessible to many. This has implications for education and several others, and more importantly, also for health. It has relevance for health infrastructure and the cost of accessing health, including not only healthcare, but public health and the cost of rolling out interventions, monitoring, evaluating, and so on. So those would just be my reflections over what we've had in the panel. Of course, these reflect directly on the SDGs, although we've not been very specific about mentioning SDGs and SDG X, Y, and Z. I think that's less important for this panel.
Exactly. Yeah. It was just putting it in the context. So we're nearly at the end. Yes, 5 minutes. We've seen it. We've just had the responses. It's never possible to get. You're very welcome to make a statement, please. We have 5 minutes left. Go ahead. Go ahead. You're invited. Please. Yeah. Yes, please. Please wait for the mic for a minute. Please make your statement.
It's just that I come from an era where we don't like if people don't listen to us. And I've had.
Please go ahead.
But
go
the point
ahead.
I want to raise is that the one challenge that we're sitting with, if we look at this whole cake and what we want to have as an outcome, it's very important that the whole thing of SDGs came up, is that I'm missing government contribution. So I'm asking myself, but why is it that the Malcolm Trusts of the world and the Bill Gates Foundations need to be the sole investors of products that have an impact on the quality of people's life? I think the second point is that we're missing in this whole debate community voices. You can't discuss rollback of SDGs without having people part of the equation. There was Cheryl raised the thing of we also experience what they call vaccine hesitancy, but also there's low levels of confidence in science. So whatever product you develop, if people don't use it, it doesn't. I mean, we're sitting with a situation with TB where we've got treatment, but it's not being used for all kinds of reasons. So I think those are just the two issues that I want to raise. The one is community involvement, the voices of people in all these debates that we're having. And then secondly, we need strong government commitment for basic science research, because that's the only way that we can be able to deal with issues of ownership of science product. So that's all that I wanted to make.
Thank you very much for this really, really important comment. And I'm sure many of the audience appreciated it very much. I think we did make reference to the fact that governments need to invest in science. The community issue was perhaps not that much stressed here, but we did speak about, how people need to be involved. But your voice and your points have been absolutely critical. So thank you very much for that. Rüdiger, I wanted to also give you, in a way, a last word. WHO is a co-operator, co-host of the summit. Reflecting on this discussion, what would you say, and including the comment of colleagues?
Perhaps just first of all to react to that comment. I can only offer all the experience of last 40 years of health promotion in community engagement, empowerment, social inclusion, and health literacy that we know works, and we also know the do's and the don'ts in health promotion. So I can just offer this to also the the science and also the pandemic preparedness. Now, just reflecting, I think that was an excellent discussion. I'm really absolutely thrilled about this because, as we said, we need to be open. We need to also let down, all this diplomacy that we're always engaged in, which is great. And we need to have it at one point, but in discussions amongst ourselves, like here at the World Health Summit, we also need to say that, to talk to the truth, right? And that is building up this trust. That is how we can engage in new partnerships. And that's why I'm so happy about this. We don't need to be always of the same opinion, but we need to be able to really reflect on that, the pros and the cons. We need to strategize about new approaches, and that will enable new partners to come in. And that's why I'm so happy about this discussion.
Thank you, Rüdiger. Thank you all for coming on this rainy afternoon. I hope there were some points you could take from that. Some of you might have the wish to speak to some of the panelists here, so please do come up and speak directly to them. Thank you for those who posed questions and gave comments. One panel, can never fulfill all the expectations, obviously, but I hope we were able to also highlight some of the new challenges that are out there. And obviously, these are also challenges that governments will need to take up and will need to reflect on. So thank you very much. Maybe you want to give these people a clap.